Well, good morning, Mississauga. I'm Brad Butt, Vice President of Government and Stakeholder Relations at the Mississauga Board of Trade, and it is our great pleasure to have you join us this morning for our webinar on the roadmap to reopen with the Workplace Safety and Prevention Services. Although we are gathering virtually today, we would like to acknowledge that many of us are gathering where we are today on the treaty lands and territory of the Mississaugas of the Credit and the traditional territories of the Anishinaabe, Haudenosaunee, Windot, and Huron people. We also acknowledge the many First Nations, Inuit, Métis, and other global Indigenous peoples who call Mississauga home. We welcome everyone. Are you a business looking for guidance on how to develop the mandatory COVID-19 workplace safety plan? Do you need guidance on how to properly screen your patrons and how to manage your capacity limits? Well, in this session, we will review workplace safety plan development, proper screening protocols, posting capacity limits, free health and safety resources that are available for small businesses. I also want to highlight our partner, the City of Mississauga's Economic Development Office, that offer a range of services and programs to support our business community through this pandemic and the road to recovery and reopening. Since the pandemic started, the Mississauga Economic Development Office created a one-stop website for businesses to access the latest information on government updates, relief packages, and services offered by the City of Mississauga. You can visit them at the website at www.mississauga.ca/business-COVID-19. The site has become a central resource for businesses and includes access to over 150 plus support and relief programs, digital technology supports, small business webinars and advisory services, health and safety resources, and much more. Following this webinar, we will be distributing these resources to you to help you navigate through step 3 of reopening. But before we get started, I would like to quickly review our event virtual protocols for today. All attendees will remain on mute as we are recording this event. A question and answer session will occur after our guest speakers have made their presentation today. If you have a question, please use that Q&A button at the bottom middle of your screen and type in your question for us to review. Questions will only be visible to the MBOT staff and our panelists. MBOT staff will review all questions that are asked, and we'll do our very best to have as many of those questions answered today. Now I'd like to introduce our guest speakers. Stella Nicastro-Greenough is an account representative for small business with the Workplace Safety and Prevention Services and has over 14 years experience assisting customers with their health and safety needs. Stella collaborates with small businesses and community organizations in the Central West region to ensure they have access to the information, tools, and resources they need to work safely. Lori Shepard is also an account representative of small business with the Workplace Safety and Prevention Services. With more than 25 years in the field of occupational health and safety, Lori connects with small businesses and communities in Southwestern Ontario to share simple safety solutions. Her volunteer activity focuses on the threads of life. So please join me in welcoming Stella and Lori to make their presentation, and then we will open it up for our question and answers. Welcome, ladies. Thank you very much for taking the time to join us today, and we're looking forward to your very timely presentation.
Thank you, Brad. Okay, let me just start off by sharing my screen here. No, let's do this one here. Okay, can you see the presentation?
Yep, we're all good, Stella.
Wonderful. Thank you. All right. Good morning, everyone. Thank you so much for joining us today. I just wanted to start off with saying a very special thank you to Brad, Stephanie, and the entire team at MBOT and the Mississauga. A special shout out also to the Mississauga Economics Development Center for their collaboration as well and allowing us this platform to speak to you today. So in today's session, we are going to be talking to you about building your safety plan. This PowerPoint is for informational purposes only and is not intended to provide advice. The information is only as current as the information that we know today, as information is always changing. And for any specific questions, we ask you to contact us directly. All right, so let's start off by introducing you to WSPS in case you've never heard of us before. Workplace Safety and Prevention Services is a not-for-profit organization committed to protecting Ontario workers and businesses. We are a proud partner in Ontario's occupational health and safety system. We offer health and safety expertise, consulting, training, and resources. Our mandate includes helping businesses understand their risk and legal obligation and stay in compliance to build a safer workplace. And of course, our vision is every worker healthy and safe every day. So our system partners, they include the Ministry of Labor, Training, and Skills Development, who is essentially responsible for administering and enforcing the Occupational Health and Safety Act, or the Green Book as we all know it, Employment Standards Act, and accompanying regulations. We have the WSIB, the Workplace Safety and Insurance Board, who is responsible for providing workers' compensation to workers and no-fault insurance to employers. And then, of course, there's us, WSPS. We are one of the health and safety associations, and our focus is on prevention of workplace injuries and illnesses. In May 2021, the Government of Ontario released the Roadmap to Reopen. Along with the Chief Medical Officer of Health and other health experts, the Ontario government has developed a 3-step plan to safely and gradually lift public health measures based on ongoing progress of province-wide vaccinations and improvements of key public health and healthcare indicators. So here is a snapshot of the Roadmap to Reopen and some key highlights. So step number 1 included 60% of adults who have received 1 dose of the vaccine. And then, of course, there's step number 2, which is 70% of adults have received 1 dose of the vaccine, with 20% who are fully vaccinated. And then we have step 3 with 70 to 80% of adults who have received 1 dose of the vaccination and 25% who are fully vaccinated. So as we all know, as of July the 16th, the province of Ontario is now in step 3. So this allows for relaxation of restrictions to indoor activities, such as indoor dining is allowed. Essential and non-essential retailers are allowed to open with limited capacity. Indoor sports and recreational facilities, indoor seating events, indoor attractions and cultural amenities, casinos and bingo halls, and other outdoor activities from step 2 are permitted to operate indoors. So for more information on the roadmap, we ask you to visit ontario.ca. So it's recommended that all employers develop a safety plan for their workplace. So regardless of what sector you're in or how large or small your business is, a safety plan is mandatory to have in place. So a safety plan provides a documented approach of what you need to do to keep everyone safe in your workplace. And the process for drafting a plan is really straightforward. There are 6 questions that you need to think about when developing your plan, and really think about developing your plan as an investment for your business. So what we're going to do is we're going to go through each individual question step by step in further detail. Okay, so we have question number 1. So question number 1 talks about how will you ensure that all workers know how to keep themselves safe from exposure of COVID-19? So what you want to do is you want to provide clear information and instructions to your workers, making sure they know what to do to protect themselves and others. Ensure they know how to follow work and hygiene practices in your plan. You want to set up your current internal communication system to provide frequent reminders and updates using a variety of ways to reach your workers. Things like posting notices in common areas like your break room and your lunchroom, communicating via emails frequently, having virtual team meetings, and if you have an intercom announcement system, perhaps making frequent announcements as well. Keeping up with public health and workplace safety guidance for COVID-19. You want to share any new information as soon as possible. And some other things that you want to consider is posting information for workers that are entering your workplace, having information in languages spoken by the workers so everybody understands. Maybe provide information in ways that are easy to understand, things like graphics or pictograms, or maybe some information and resources available on the Ontario government website. You want to remind workers about available social and mental health supports and encourage them to use it. It has been a long pandemic. It has been 16 months, and there's certainly a lot of people out there struggling with mental health issues because of the pandemic. So be kind, support one another, and certainly encourage your workers to take advantage of those mental health supports. You want to share information to keep your workers safe, and perhaps if they're commuting or traveling as part of their work. And you want to train and retrain on procedures, right? So frequent communication is certainly the key here. So question number 2 talks about how are you going to screen for COVID-19? So you want to make sure that all workers know to stay home if they have any symptoms, and screen all workers for COVID-19 symptoms. So there are 2 types of screenings. There is a passive screening where people access their own risk factor and make decisions themselves. Like, for example, if you're going into a grocery store, for example, you would assess your own symptoms and make that assessment and enter the grocery store. And then, of course, you have active screening. This is the result of a screening assessment that is being reviewed and determine if a person can enter your workplace. So, for example, if maybe you're going to an appointment, a doctor's office or a dentist's office, where you get stopped at the door and asked those questions. So there's a difference between the 2 screening. So screening should occur before or when the person arrives at the workplace in the beginning of every shift or visit. And a screener or automated system should advise anyone who doesn't pass the screening protocol that they can enter the workplace and they need to go home to self-isolate immediately. And also what they want to do is they want to contact their public health provider or Telehealth Ontario for any further information and for further instructions. You can also screen visitors and clients by phone or through an app before they arrive for their appointment. I've had this done at hair salons and nail salons, so there's an example there. And also use signage. So post clear signage at all entrances with screening questions and instructions. And certainly encourage your workers to self-monitor and encourage them to find or be able to find the online COVID-19 assessment tool and where that is. So question number 3 is how are you going to control the risk of transmission in your workplace? So COVID-19 can be spread by people who don't have symptoms. We all know this is a symptomatic person. This is why it's very important to have effective control measures in your workplace. We want to maximize physical distancing and separation. So this is really the key here. And where possible, workers should continue to work from home and meet virtually until public health authorities advise us otherwise. To ensure workers maintain physical distancing of at least 2 meters from other workers in place, using a variety of engineering or administrative controls. These are things like the barriers and the plexiglasses to maintain separation. Certainly scheduling and reducing the number of people who can share the same space, like during shifts or lunch or on breaks. Providing adequate space for using and repurposing all available areas inside or outside your facility. All right, and then source control masking. So using masks as source control involves having workers, visitors, and clients in the workplace wear a mask to help them protect them and those around them. Masks are especially important indoors and can help reduce the risk of situations where physical distancing can't be maintained. And masks really should not be worn as a substitute for physical distancing. Think about maybe your ventilation and your airflow. So some additional steps that you can take is using portable air cleaners, keeping the windows and the doors open. It's a beautiful time of year, certainly getting that airflow going. And maybe even think about adjusting your HVAC system to increase the amount of fresh air. We want to reduce transmission from surfaces and objects. This is all about identifying commonly touched surfaces and commonly used areas and put in place a schedule to have them clean and disinfect regularly. Regularly cleaning and disinfecting any shared equipment, tools, in between users, making sure that you're using the right cleaning solution as well. For this example, I have actually 2 stories to share. I've been at many retailers where you see them use a rag and a cleaning solution, but yet they're using the same rag over and over and over again, right? So they're not really, you're just kind of spreading around those germs, right? And then there was another situation where I was in a store and I saw them using a bathroom bleach cleaner, where it involves spraying it, right, and then rinsing it off with water, and they weren't using it properly. They were just spraying it and spraying it over and over again. And can you could imagine how very strong the bleach smell would get. So it's all about using the right cleaning solution and training your staff how to use that training solution. Lysol wipes, disposable Lysol wipes would be the best solution here. And you want to support good hand and respiratory hygiene. Have all your workers and visitors properly clean their hands before entering the workplace and after contact with objects and surfaces that may have been touched. So at this point, I'm going to hand it off to Lori to finish us off.
Great. Thank you, Stella. Okay, so question number 4, we're going to be talking about what do you do in the event that you have a potential case or suspected exposure to COVID-19 in your workplace. If we could just go back 1 slide, that'd be awesome, Stella. So basically what we need to understand is we need to think about this ahead of time. So we need to identify if it's one of our workers, what about a visitor, a client, even volunteers? Do you have interns? Do you have co-op students? Think about all the people that come in contact in your workplace. So if they have symptoms or they've been diagnosed with COVID-19. So step 1, what we want to think about is how are we going to exclude that person from the workplace? So Stella had mentioned it's really important to ensure that those people are calling in sick, and if they've informed you that they've got the symptoms, they've had close contact with somebody who has tested positive or has the symptoms, that they would take a self-assessment test. And these can be accessed through the ontario.ca website. So make sure that people know this ahead of time. You don't want to be panicking when you're in this situation and now what are we going to do? You want everybody to be clear on what they need to do. So ask the worker to follow any recommendations that are given by the tool, including being tested or self-isolating. Now, what happens if somebody actually shows up to the workplace? So this is where they should actually return home and self-isolate immediately. Now, if that's not possible, you want to make sure that you have an isolation room. So you've already thought about this ahead of time. You know where they can go. So what if they have to wait for a ride, something like that? So we want to make sure that we know where we can isolate this person. Have a plan in place to deal with this and train everybody, your supervisors and all your staff on how to handle the situation. Now, what if they become very, very ill? And sometimes people can turn on a dime. So this is where people have to be trained again, call 911. So there are some cases where you may need to call 911 and let the operator know that you may have a suspected case of COVID-19. So in the event that the person is just going home and isn't going to the hospital, this is where you would ask the person to contact their doctor or Telehealth Ontario and get further direction as to whether testing or self-isolation is required. Okay, so that's all in step 1. Lots to think about. Number 2 is about contacting public health. So you've dealt with the individual and now you're going to contact your local public health unit. So they're going to give you some instructions. You may need to do some contact tracing if it's needed. And ahead of time, you want to think about having that contact tracing system in place ahead of time and making sure that you have all of this information so we can get in touch with those people who have or may have had close interactions with the affected worker. Now, sometimes you may have gone through this yourself. I've been fortunate to be out on some patios lately, and we've had to sign in. So they have a simple sheet even before you're allowed on the patio, taking all of that information. So just keep it nice and simple. Think about it ahead of time so then you can get in touch with people that need to be contacted. Okay, so step 3 is follow all the public health direction. So you may need to let other workers know as well. If they were exposed, they may need to be sent home and to self-isolate. We've seen outbreaks in several workplaces that have actually even had to close and do a deep contamination as well. So there may be different things that you need to do, and just follow that guidance from the public health unit. There is a really great document from ontario.ca that has provincial guidance on the management of cases or suspected cases in your workplace. So check that out as well. Okay, so step 4, making sure that you inform all the workers who have been exposed. And this can be delicate as well, because you need to maintain confidentiality as well. And sometimes in really small workplaces, this can be a challenge. So you don't want to give out any specific information that might identify the potentially infected person. And again, this can be a very delicate balance. People may figure it out, but just make sure that you do your best to maintain confidentiality. Again, that contact tracing is so important, and making sure that you follow all those protocols. Step 5 is we've got to let people know now. So who do we need to let know? The Ministry of Labor, Training, Skills and Development. So the MLTSD, you need to advise them within 4 days. So once you know that somebody has either tested positive or that there's a potential exposure, if a claim has been filed with the WSIB, the Workplace Safety and Insurance Board, any of that stuff. So as soon as you can, as soon as you're able to, I always say err on the side of caution. If you don't know what to do, just make sure. So you have 4 days, and this notice needs to be given in writing. And you also have to let either your Joint Health and Safety Committee or your Health and Safety representative know. So in smaller workplaces, if you have between 6 to 19 workers, you are required to have a health and safety representative. This is a worker rep who's chosen by the workers for the workers. And what do? A lot of what they do is they help to kind of monitor your internal responsibility system. When Stella talked about the Ministry of Labor's role, the foundation of the Green Book is the internal responsibility system, right? Everybody has a part to play, the employer, the supervisors, the workers, and part of the role of monitoring this system comes down to that health and safety representative. And how they do that is by being engaged and helping to maintain health and safety in the workplace. If you have a larger workplace, if you have 20 or more workers, you would have a joint health and safety committee, which has management and worker representatives. So make sure that you notify those individuals as well. They need to be involved. If you have a union, you need to advise them as well. So lots of people to notify. And then you also need to let the WSIB know. The Workplace Safety Insurance Board needs to be notified in 3 days, within 3 days of you being notified of the illness. And again, you don't need to know at this point. You don't need to determine where the case was acquired. Just if it's reported to you as an occupational illness, you must report the case. So an investigation will be done after the fact, but just make sure, again, that you know who to get in touch with. So lots of things to think about in step 4. Okay, so step 5, question number 5 of the safety plan has to do with managing any new risks that have been caused by the changes to the way you're operating your business. So think about the cleaning agents that Stella just talked about. You may be introducing new chemicals into the workplace. We've sure been sanitizing our hands a lot more this year. And have we made sure that we've got our WHMIS up to date, our WHMIS training, Workplace Hazardous Materials Information System. And remember too that chemical management is more than just WHMIS, but part of WHMIS is understanding what's in the product. How do I work with it safely? How do I store it? How do I handle it? Do we have it properly labeled? Are we wearing personal protective equipment like gloves? Those kinds of things. Do we have the right gloves? Because not all gloves are created equally. Those kinds of things. And also, if we're working around machinery, we have to make sure that we understand that gloves and machinery don't work. We don't want to create another hazard by potentially getting entangled in a machine because we're wearing gloves. So we need to think about that. We need to think about, some workers have been away from work for a really, really long time, and now they're coming back. So let's think about making sure we do an effective orientation, that we have these new processes processes and new protocols in place that everybody knows what they're supposed to do. And sometimes we're restarting activities or machinery that's been shut down. Do we make sure that we've got our maintenance on those machines, that they're working properly? And like Stella said, stress, right? There's a lot of stress. We're all kind of a little stressed out right now. There's a lot of change going on. And consider the effects on our mental health. And I think I can't say it any better than what Stella said. It's about being kind to each other. So we can all play a part in this. We all want to be part of a positive workplace environment and not be in that toxic environment. So many things to think about here. There's so many changes, and we need to consider what all these changes and all these protocols and what kind of an impact they're having on our workers. Even think of something like if you used to have 2 people. I used to be a restaurant manager, and we'd have the big kegs of beer, and we would require, our procedure was 2 people for the safe lifting. Well, if we're trying to maintain that, 2 meters or 6 feet of physical distancing, how can we do that? So how can we make sure that we're not injuring our workers and we're not maybe causing a musculoskeletal challenge, like by injuring somebody's back because now we're expecting somebody to lift things by themselves that they just physically can't do. So we need to think about all this stuff so we're not having other injuries, because your other hazards don't go away. Even though a lot of our attention and focus is on the COVID-19 situation because of the tragic outcomes of it, but we still have to think about, again, our slips, trips, and falls, our machinery, our other chemicals in the workplace, the psychosocial hazards. There's so many things that we need to think about as well. So this is what element number 5 is all about. Okay, so now we want to say, hey, is our plan working? So sometimes things look fabulous on paper, but then we want to monitor. We want to talk to our workers, talk to everybody. Is it working? And that's why I really encourage you to talk to your staff as you're developing this plan. You may kind of want to draft it, involve your joint health and safety committee, involve your health and safety rep. Say, does this make sense? Because sometimes you think it might be a really great idea, but then you start to see that it's not working. And I always like to get to the root cause. If somebody's not following the rules, why? Why aren't they following the rules, right? Rather than, jumping to conclusions, let's find out. Let's get to the root cause. Let's find a better way. And collectively, we can all do it together. So when we have buy-in, last week I had the opportunity to coach somebody with their safety plan, because that's what we do too. So we can help coach you. And we created it together, and it didn't take that long. It was pretty good. But I said really upfront, nobody likes to be told what to do, right? Nobody does. So if you get buy-in right up front, we really value your input. What do you think? And that's what this is all about. So a plan is not static. You want it to be a living, breathing document that you're constantly kind of evaluating what's working, what's not, and how can we make things better? And that's really what it's about. So I encourage you to do this, because sometimes we go, woo, that's done. We got it finished. Yay. And then we just put it away and we never even consult it or look at it again. So I encourage you to, that's what step 6 is all about, making you think about it and how are we going to monitor and how are we going to make sure things are working. Okay, so we've covered lots and lots of information. So we know that the situation is evolving. Stella mentioned that, today this presentation is current. Things could change in a couple days. They could change next week. We know that it's constantly evolving, so we want you to be aware of what's happening. So the first thing we want to do is make sure that you're constantly in contact with your local public health unit, that you're aware of the relevant bylaws in your municipality, that you're familiar with the regulations, including Reopening Ontario, a flexible response to COVID-19 Act. We will make sure that you get the links to all of this, understand how it applies to you and what it means. Make sure that you're following the directives by the Chief Medical Officer of Health, and again, that are applicable to your industry, your business. So we're going to, again, make sure that we provide all these links to different guidance documents. We have templates. There's a template for a safety plan, and we have some samples. We have a number of different samples. The person I was helping last week, there wasn't a sample that totally fit her situation, but we looked at which one's kind of the best, right? We looked at the best one, and then we tweaked it. So you always want to personalize it, make it your own. But the templates that are out there, we have one for restaurants, bars, and food establishments, facilities for sports and recreation, meeting and event space, retail space, the personal care, support services, casinos, bingo halls, gaming establishments, cinemas, and performance management. So those ones are very unique, very specific. But the one I helped with was for a commercial bakery with retail. So we were able to modify it. And it didn't take us that long, maybe about a half an hour. But just know that we're here for you and look at those samples. We also have some videos and all kinds of resources to help you. The Ontario Roadmap to Reopen, again, check that out. That's where you're going to find that really nice colorful slide that Stella showed you. There's a lot of detail where the specifics, it talks about the capacities, what's allowed, what's not allowed, and those kinds of things. Screening tools, the active and the passive screening tools, make sure you know about them, how to access them, that your staff knows how to access them. I got to go to a meeting last week with a couple colleagues. Whoa, it was so exciting, but we had to do the active screening ahead of time. We had to get approval. We passed it, and we met outside on a patio, and it was so awesome. Like when you haven't seen your colleagues in, 15, 16 months, pretty cool. So yeah, so you need to do this. So it was really easy for me to do, and I was able to figure it out because my employer made sure I had access to all of that. The documents, the guidance documents, I'm going to cover off on that. I've got a slide coming up in a moment. The roadmap to reopen in you. There's webinars very similar to the one we're doing today, except for we also have a guest speaker from the Ministry of Labour, Training, Skills and Development. So we have created 3 of these. There's one for each of the steps. So of course we are now in step 3, but if you want to check them all out, they're posted on our website as well. And then of course, like I mentioned, General Occupational Health and Safety Act guidance. You don't want to forget again about your machines. You don't want to forget about those other hazards. There is more risks and hazards out there besides just COVID. So we don't want to drop the ball, and we don't want people to get, again, hurt backs or amputations or all those other kinds of things. We still need to look at, again, slips, trips, and falls, working safely when we're using ladders and equipment. So lots and lots of things. So don't forget about the other hazards in your workplace, especially other hazards that, again, the personal protective equipment or PPE might cause. We created this post-pandemic playbook at the beginning of the pandemic, and it's constantly being modified. This is an awesome document. We created it in partnership with Lear, and it's not intended to be a one-stop kind of one-size-fits-all approach. It's basically considered to be a guideline. It's got practical tools and advice. We consulted, again, the Ministry of Labour, Training, Skills Development, Health Canada, Public Health Ontario, as well as the WSIB, even government of in the States, the CDC, which is the Centers for Disease Control and Prevention. There's also lots of guidance material from our own organization, WSPS. So it includes those things like the employer responsibilities. It includes the hierarchy of controls, right? What's the best way to control a hazard, right? Eliminate it. If we could do that with COVID, it would be awesome. But we can't. So right now, there's other things that we can do. Making sure that you understand the screening. So screening's in there, isolation protocol. And it's a really quick reference book too. And again, the fact that it is online and in an electronic format makes it so easy because there's a search feature and you can have this. And it's always being updated, so it's current. So I encourage you to you don't even have to print it out. You just make sure you search for it. Information on physical distancing protocols, decontamination measures, training and communication. A lot of health and safety is those soft skills, the communication, right? How are we going to ensure? How are we going to talk to people? How are we going to make sure that our message is going to be heard? How are we maintaining, like we're all hearing that people are just so tired of COVID, right? I've heard that so much now, but COVID's not done with us, right? So this is where it's really, really important that employers remain vigilant. So this is where having those soft skills, the communication really comes into play. So encourage you to kind of check it out. We'll make sure, again, you get the links. Okay, health and safety guidelines. We have created hundreds of these in partnership with the Ministry of Labor, Training, Skills and Development, and our other sister partners. So there are 3 other health and safety associations. So I think there's over 200 altogether in the system. On our website, we have just over 100, and they are very specific, and these are guidance documents. So if you're looking for a guidance document, again, for the retail sector, for the office environment, we have these for agricultural sector. So check them out, because they've been sanctioned by, again, the experts, the health and safety experts use these guidance documents to really help you. And they are available in a variety of different languages, including English. Some of them are in French, some of them are in Spanish. So check these out, and they can really help you. And they can also help you to assist you with the creation of your safety plan as well. A few other things that I just want to do a shout out for is we have created a small biz safety podcast. So this is something that you can listen. It takes about, most of them are 20 to 30 minutes. I got to participate in the July one, and we were talking about, again, chemical management. It's more than just WHMIS. We've done sessions on heat stress. We've done things on taking care of your mental health, violence and harassment. We've done sessions on screening requirements, and again, the safety framework and building your safety plan. We also want to hear from you. Let us know what your issues are, what your concerns are. It's conversational, it's upbeat, lots of practical tips. We have show notes with links, so you can listen when you're on the go, and all you have to do is download the app. But check us out, and again, tell us what you want to hear, right? And they're a lot of fun. Okay, we have an app, and this app is something that, again, it's a mobile app. It's in plain language. It's lots of commonly asked questions are here, quick access to content like checklists and videos and articles, all to do with the COVID-19 situation. We encourage you to share this with your friends, your family, your coworkers. And if anything changes, you can be notified of all the changes, because again, things are evolving so quickly. So check this out as well. Okay. For small businesses, I know there's probably lots of small businesses on the phone. So if you have under 50 workers, so 1 to 49, you are considered a small business in this province. So we have created this small business center. So if you go to WSPS.ca, you can click on the small business center. We have created 3 safety roadmaps. You'll see on the left-hand side, 1 to 5 workers, 6 to 19, and 20 to 49. Click on the one that suits you. If you're on the cusp, again, I always say err on the side of caution. I was chatting with somebody yesterday. They have 5.75 workers, getting pretty close to 6, right? So I said, okay, you may want to start looking and being prepared, so you're not caught on kind of unprepared as you're growing. Because I said, are you growing? Are you hiring? Yes. Okay, then start thinking about the next category. The first thing I encourage you to do is there is a checklist. And the checklist is for you to kind of just look at your system. I always say to people, just be brutally honest and answer the questions. It's yes or no. It's not a yeah, but, right? If it's yes or no, and then it will help you to identify gaps in your program. And then there's all kinds of tools, resources, downloads to help you take it to the next level. And of course, we're always here for you. If you're wanting to find out again how to build that business case for safety, what does it really mean, right? There's all this information. For every dollar we invest in health and safety, here's how much we get, right? Our return on investment. And of course, there's the link to those great COVID-19 resources that we already talked about. Okay, last but not least, The Small Business Advisory Service is here for you. You may be feeling overwhelmed because I've covered lots of information. Stella's covered lots of information. And we really believe, both Stella, myself, our whole organization, that health and safety doesn't have to be complicated. So we're trying to simplify it for you. So we have these dedicated, passionate people. They're volunteers who work in health and safety. They are health and safety experts. They have a designation that's called the CRSP, Canadian Registered Safety Professional. So they have the knowledge, the education, the expertise, but they also, again, have the experience and very, very passionate. For years, we've had volunteers. We've been around just over 100 years. 1917 is when we formed. And since the beginning of this, we've had volunteers who have wanted to make a difference. They want to give something back to their community. And this is one way they can do it. So if you're looking for a coach, somebody to walk you through all of the stuff, somebody to say, hey, can you help me with my safety plan? Can you help me with this? It's totally up to you. You get to work with your coach, your advisor, and determine what success looks like for you. So I have had some people say, Lori, are you for real? This is really free? Yes, it is. Trust us. And we're not looking for you to report back to us. This is, again, confidential. Just at the end of the program, we're going to look at big data. What worked, what didn't, would you recommend this to a friend, that kind of thing. But check us out, reach out to Stella, reach out to myself, and sign up for this. You've got nothing to lose. And I guess on that note, just before we open up to the Q&A, we had a special announcement last week. The Ministry of Labour, Training and Skills Development, they want to give money back to small businesses. And yes, they do. Again, is this for real? Yes, this is for real. Again, those workplaces that have 6 to 19 workers are legally required to have that health and safety representative in place. So sometimes people don't know, what is it they're supposed to do, right? So right now in the province, there is training that's available, but it's voluntary. It's not mandatory. Like in the bigger companies, when you have more than 20, there is mandatory certification training for at least 2 members, the worker rep and a management rep on the Joint Health and Safety Committee. A lot of companies will do more, but that is mandatory training. But for the health and safety representative, it's not mandatory. And it costs $25 and it takes about 8 hours. It's an e-learning course. But the government decided, let's reward those small businesses who are going that extra mile, because it's been a really tough year. And we know that it's been a really tough time for small businesses. So let's reward those businesses who are going the extra mile. So what the government has decided to do, they're investing a lot of money in this, and we'll make sure that you have the link to this as well. Not only are they going to reimburse the company for the $25, so the company signs up for it, you can sign up through us as well. And when you're done and you've shown that it's your worker health and safety rep who has completed this e-learning, they're going to give you a bonus of $150. So you're going to get $175 back. So they're hoping that that's going to cover, the time, the wages for that individual who's taking the training. So $175, and they're also getting the education, the knowledge, and the skills, because we want this person, they're such a valuable part of your whole health and safety program. And let's make sure that those people know what they're supposed to do. We want them to be effective. We want them to be efficient. And this is one way to do that. So I just wanted to give you a shout out to that, because it was just announced on Thursday. There was a big press release by the Minister of Labour. So so that's all I've got. And I just encourage you at this point in time to answer or ask any questions, and we'll do our best to answer them. Stella's going to come back on here with me. And again, if you want to use the chat room or just let us know if you have any thoughts, comments about what we presented. If anything's a little confusing, let us know if you have any questions. So thank you.
Well, thank you very much, both Lori and Stella, for an excellent and very thorough presentation. Just before we get into the Q&A, a couple of things that I'd like to mention. Number one is that small business health and safety training program you referenced. We did put information in our weekly bulletin on yesterday, out to our members about that. So members of the Mississauga Board of Trade, you will be aware of that program and the direct links in there as to how you can participate. So that was an excellent announcement by Minister McNaughton last Thursday, and we're hoping businesses will take advantage of that. The second thing I'd like to mention to those on the call today is that the Mississauga Board of Trade actually has two workplace programs that are available through our website at mbot.com. First is the fast antigen screening test kit, which is for businesses specifically on doing rapid testing in the workplace. And second is we also have rapid test kits available for companies to sign up and register through our website if you want to have rapid test kits for antigen screening at your places of business. They're available for free, and they're available through the Mississauga Board of Trade. So if that is one of those tools that you'd like to have at your place of business, I would certainly encourage you to order those from the Mississauga Board of Trade. But let's get into the Q&A that's been submitted by our audience, and I'll read out the questions, and whoever is the appropriate person, or both of you, to answer, please jump in and do so. So do all employees in a small office setting need to be WHMIS trained?
Yes, there is a requirement under the WHMIS regulation to have all your workers trained on WHMIS. So again, when you create your WHMIS program, you need to do this in consultation with either your health and safety representative or your joint health and safety committee to determine what kinds of training are required. Even in an office environment, sometimes we don't think there are a lot of chemicals, but things like toner for the photocopiers, even things like liquid paper. I know I'm dating myself, but yes, liquid paper. And also the fire extinguishers. So the minute you have any WHMIS controlled substances, and of course, sometimes there could be the cleaning agents and those kinds of things. So yes, WHMIS training is required. So just check out the WHMIS regulation, and we have all kinds of resources as well as some free awareness sessions on our website. So at least start with the free awareness session, and then you can go from there to determine what kind of training, how often do we need to repeat it. There is a little bit of confusion too with the training. Some people think that it's mandatory to have it done annually, and that is not the case. You need to review your program annually. Does it make sense? Do you have any new products? Those kinds of things. And then in consultation again with your proper people, you would determine what kind of training. A lot of times when people do training, they'll do something like a confirmation of understanding too. Make sure anytime you do training that you keep your records. And we have those templates on our website as well for maintaining all your records of training. So keep that as well. Yeah.
You want to add anything, Stella, or is that good?
Nope,
Okay.
that's great.
Great. We'll move on to the next one. So you spoke about the privacy of our employees. So does that mean if an employee tests positive for COVID, we cannot tell the rest of the employees that work closely with that person?
Correct. The privacy is a huge concern, and we do understand the challenges with that. You need to tell them that they've come in contact or potentially come in contact somebody, but you can't specifically say, that Lori Shepherd, no, you would have to say, we have a suspected case, because at this point too, we don't always know. And even when we find out, and again, we know the reality of the situation. People will probably most likely figure it out, but you're not to engage in that. You would just say, I'm not at liberty to discuss this information, and make sure that's why when you do the safety plan, you say, okay, one of the challenges in the workplace is we could all test positive. We could all come in contact with people. So how are we going to do this in a sensitive way? So yes, we can't give names. You have to give as much information, but as little information. So you don't want to actually identify with a name, but you would say we have a potential case. And people might say, oh, I know who it was. It was that Lori. And you go, again, I'm not at liberty to discuss this. This is confidential. And then you have to shut down. We don't want to have those discussions over the water cooler in the lunchroom. And that's where everybody has a part to play. Again, when we talk about those environments, we all want to be in a respectful workplace environment. This is part of it, is that we're respecting the confidentiality of our colleagues, our peers, our coworkers, and that's what we need to do as well. So shut it down, and we all have to be part of it. Where none of us can kind of take that, like, I'm going to be an innocent bystander, I'm just going to watch this. So where we see it too, we shut it down, right? Yeah, it's challenging though. And even if people figure it out, you do your best still to shut down those conversations. Does that help?
Anything else, Stella?
Nope. Nope,
Okay,
nothing
so
at
I'm
all.
going to ask a couple of questions that I have, because I don't think we have any more that I saw in the Q&A box at this stage, but we've got time for maybe a couple more questions before we wrap up. What do you say to an employer that says, all my employees are vaccinated now, I don't need to do any of this stuff now, everybody's told me they've got their 2 doses, they're done? What do you say to an employer like that, a business person like that, when we all know that there still needs to be some protocols in place? Public health officers are still saying, it's not back to 100% normal. We still want you to do things. So what do you say to an employer like that?
That's a great
I'll just
question.
quickly
Oh, sorry.
jump in. Yeah, I'll just quickly jump in, Lori. I would just say you need to follow the protocols of your municipality. You need to follow the protocols of the Reopening Ontario Act, and you need to follow the protocols of the Chief Medical Officer of Health, right? And so you have to be vigilant, right? I know we're all tired of COVID. We all have COVID fatigue, but you need to have these things in place. If a Ministry of Labor inspector does come into your workplace, you betcha they're going to be asking for your safety plan. That's one of the first questions they'll ask. So we need to stay vigilant. We need to make sure that we have protocols in place to make sure that we're doing everything in our power to keep our workers, our employees, and our customers safe. And Lori, would you like to add anything to that?
Oh, sure. I think that's really good point, Stella. And this question, Brad, we get it all the time. Vaccinations support the other controls. And when we talk health and safety, we always start with the hierarchy of controls. And that's with, again, elimination, substitution, engineering controls. We've all seen the plexiglass, administrative controls, organizational or operation controls, as well as the personal protective equipment. So we still want to always apply those to every hazard situation, not just the COVID situation, whether it's a biological hazard or not. So we always encourage that. The vaccines will only supplement and they support the whole control program. And like Stella said, we have to continue to follow the regulations and the laws that are out there and still keep people safe. Yeah, and in workplaces too, if you can't maintain that 2 meters or 6 feet of physical distancing, that's where part of the controls is they have to wear PPE, personal protective equipment. So we've all seen out at the hairstylist, people wearing a face covering or a mask, as well as goggles or a shield. That's what the legal requirement is. In my local neighborhood, we had an outbreak at a pizza parlor, and they were all, they're shoulder to shoulder, and they weren't wearing the PPE. So there was an outbreak, and we're still seeing that. There have been some outbreaks at grocery stores and hair salons, and as well as even some long-term care facilities. So yeah, we have to maintain vigilant. So I'd say it's great that we're doing this, but at the same time, we don't want to let our guard down, right? Yeah, great question though.
And it's also important to remind the folks watching today that the city of Mississauga also has a mandatory face covering bylaw for all indoor places till September 30th. And there's even talk, councillors are even talking about extending that beyond September 30th. So it's important for everyone watching today to know that in your place of business, any congregate indoor setting, your employees are required to wear face coverings. That's in an office building, a factory, doesn't matter where it is. If you're indoors, you are required under the municipal bylaw, not just provincial regulations. You're also required under the municipal bylaw. So I just wanted to make that point. Is it mandatory to keep records of COVID-19 screening of employees?
Yes, you want to keep your records. And I believe the guideline in our guidance document says at least 30 days, if I'm not mistaken. Does that sound right, Stella?
Sounds about right.
All that. Yeah, so you want to keep all your guidelines in case, again, a suspected case. What if, again, it's a customer and they let you know, so then you would keep all your records. So keep records, and you can always, again, err on the side of caution. Some companies will even have a records management policy. So how are we going to maintain these? How are we going to keep the confidentiality? How are we going to destroy them? How are like physical documents, and even also data, right? What are we going to do with our stale data? Those kinds of things. So a lot of companies will have a records management kind of policy thought about ahead of time, and then you can get the exact date that is recommended for keeping these documents. But I think I came across 30 days, if I'm not mistaken.
Okay.
Yeah.
I'm not sure either of you can answer this. I'm not even sure I can answer this. Is there, once step 3 has exhausted itself, I mean, what someone's asking, is there a step 4 or step 5? I don't think we really know right now. The provincial government hasn't given direction on what is going to be after the 21 days of step 3 have expired, what the next steps are. So I'm not quite sure any of us can answer that one today. It could just be that everything goes back to normal, but we don't know that yet. I don't.
Yeah,
we don't know that.
Stella, Lori, you want to
No.
add to that? I don't. We don't.
Stay tuned.
Yeah, we all
Okay.
find out at the same time.
Yeah, stay tuned.
Yeah.
Yeah.
Stay tuned.
Here's someone asking, and again, I don't think I would expect either of you to answer this, but you can certainly type in if you want. And we just issued a statement on this yesterday, actually, the Mississauga Board of Trade. Are employers allowed to request proof of vaccination from their employees?
That's a good one. Yeah, we
No.
had a feeling we were going to get this one.
Do you want to do that one, Stella, or do you want me to?
No, you go ahead and elaborate on that.
Okay, basically under the Green Book, Occupational Health and Safety Act, there is nothing specific in here, right? Even to do with COVID specifically, but section 25(2)(h), the employer must take every precaution reasonable to protect the health and safety of their workers. So what does that mean, right? In the context of COVID-19, it's applying the hierarchy of controls. There is no mandatory requirement for people to take vaccinations. It's a personal choice. People have their own belief systems and their own reasons and their own health concerns, but whatever it is, it's personal, it's an individual choice, and they do not need to disclose that to their employer. However, we know that things are changing and evolving, and we're hearing all kinds of stuff, but this is where we always say, in a case like this, make sure that the employer consults with legal, that they get some legal advice on what they're going to do, because we're hearing a lot, we're reading a lot, we're seeing, well, this workplace has mandatory vaccinations, but right now there is nothing in the legislation, and all we can do is follow the legislation. So yes, there's no mandatory requirement, and legally we cannot ask. If somebody wants to disclose, because we're all like, some of us are getting them, we go, woohoo, I got my second vaccination. If people want to talk about it, but again, we need to watch in our workplace. I did get a call a couple weeks ago. We don't want to be harassing or bullying the people for whatever reason. So again, shut it down. If it's in the lunchroom and somebody's talking about it, and then if I chose not to, I don't need to be defending myself in the workplace too. So have those conversations, and that's something that is very sensitive, very delicate. We have to be tactful, diplomatic, and we have to respect that we still have personal freedoms and choices in this country, in this province. So how are we going to create that safe space for everybody? And we have to understand, we don't all have the same value of belief system. And some of us may even have some pre-existing conditions that maybe it precludes us from getting vaccinations. We don't know, and it's not our business. Right. So, I got a call about that just last week, and they said they were having some issues kind of around bullying around the lunch table, and how they wanted to know what they could do. I said, shut it down. You have to shut it down, and everybody can show leadership. The employer, the supervisors, the workers, everybody can kind of be active in it, not passive. Shut it down. So hopefully that will help.
I think that's excellent advice. And I know the government itself is struggling with this issue, and certainly in specific sectors where mandatory vaccinations are something that really are considered to be an essential health and safety aspect. So I know the government is struggling with this too in my conversations I've had with several ministers and others. But Stella and Lori, thank you both very much for an excellent presentation and handling the questions extremely well. I've just got a couple of housekeeping items for those watching to be aware of for future events that are being hosted by the Mississauga Board of Trade. I should actually, first of all, thank our co-sponsor of today's event, the City of Mississauga's Economic Development Office. Thank them for being a part of this and promoting the opportunity for Mississauga businesses to participate on this today. But coming up August 10th, join us for another MBOT webinar on HR and health and safety challenges and success. August the 11th, join us for our monthly Good Morning Mississauga. And on August 25th, we're hosting another MBOT webinar, The Happy Organization. Is that important or not? I think we all like to work in a happy organization, I would hope, but maybe you can get some tips on how to make your businesses and your employment areas even happier and more welcoming for your workers and your customers. So on behalf of all of us at the Mississauga Board of Trade, thank you again, Stella and Lori and Workplace Safety and Prevention Services for today's presentation. And as always, we wish you all continued success in your business.